This podcast is sponsored by PAX. Whether on water, on land or in the air, PAX bags are both versatile and flexible backpacks that are perfectly suitable for your requirements in the most demanding of environments. PAX bags are highly regarded due to their exceptional performance in pre-hospital and in critical care environments. Renowned for their durability, they endure harsh conditions while providing rapid and reliable access to essential kit. So their well-organised compartments and customisable configurations enhance efficiency in high-stress situations. PAX bags are designed with infection control in mind and are easy to clean and disinfect. Their highly visible colours and reflective strips add quick identification and adherence to quality standards, assuring reliability. The versatility of PAX bags caters to a diverse EMS providers, but also delivers vital equipment and durability and ease of use for pre-hospital critical care services globally. I've used PAX bags in a number of critical care situations and they're absolutely excellent. Please see the show notes for further details. This podcast is sponsored by Well Medical. Well Medical specialise in life-saving defibrillators and emergency medical equipment. Trusted by healthcare professionals and first responders across the UK, they're committed to making high-quality, reliable medical tools more accessible. In a world where every second counts, Well Medical provide cutting-edge defibrillators designed to be easy to use even for non-professionals. Their products help improve survival rates in cardiac emergencies, making them an essential tool in schools, offices, gyms and public spaces. Their most popular model, the iPad SP1, offers voice prompts and simple visual aids, ensuring anyone can confidently administer help. Beyond defibrillators, Well Medical offer a range of first aid supplies, making them a one-stop shop for emergency preparedness. They also provide training and support, ensuring individuals and organisations know how to use the equipment when it matters the most. Well Medical doesn't just sell products, they're passionate about saving lives, so their dedicated customer services and comprehensive support ensures peace of mind for everyone who invests in their life-saving technology. So visit Well Medical today to learn how you can make your space safer for everyone. You can also visit the show notes for further details. Welcome back to the podcast. In this episode, we're going to be speaking with the authors of a recently published and commissioned study by the GMC on team working, understanding barriers and enablers to supportive teams in UK health systems. It's just important to make this distinction before we kick off with the interview that although this study was commissioned and published by the GMC, the views and indeed the perspectives in the interview are from the researchers. It's a fantastic interview. I got a lot from this interview, and indeed it was great just to walk through all the different elements of the study really. So please do enjoy.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.
Welcome back to the podcast. In this episode, I'm going to be speaking with Millie Kehoe and Paul Crampton around understanding barriers and enablers to supportive teams in a UK healthcare systems context. So in the conversation, we're going to examine and explore the complex dynamics of teamwork in healthcare. We're also going to look at effective teamwork and how it's crucial for delivering safe, high-quality patient care. We're also going to look at the fact that there are numerous factors that can either enable or indeed hinder its success. So we're going to delve into the findings of a comprehensive study which has recently been published with the authors of the paper commissioned by the General Medical Council. So the study uncovers some of the key enablers such as effective communication, leadership, a positive culture, as well as some of the barriers including hierarchies, workload pressures and lack of role clarity. So we're going to examine the unique challenges faced by different healthcare professionals, including junior doctors, international medical graduates, and those in emerging roles. We're also going to explore some strategies to foster supportive, cohesive teams across healthcare systems. So as I said before, I'm joined today by the authors of this paper, Millie Kehoe and Paul Crampton. Welcome both to the podcast.
Hi there.
Thank you for having us.
Before we jump into the questions, I just wondered if I could just get you to both speak to just your roles, actually. Millie, if I could just get you to go first.
Yeah, so I'm a lecturer in medical education at Hull York Medical School, but my background is kind of medical education research. So I was a research associate for quite a while. So I've done a lot of work with regulators like the General Medical Council, and this research that they commission is just totally on topic of like kind of what our team are really interested in look at. And so my PhD was looking at interventions for international medical graduates. So some of them factors also come up within this study. So yeah, just a really interesting study for us. And obviously I do kind of half research, half teaching now. So I'm still doing lots of research.
Fantastic, absolutely fantastic. And Paul, to yourself.
Yep, so I'm Paul Crampton, so I'm a senior lecturer in medical education. I'm the director of our health professions education unit at the Hull York Medical School, and also involved with various kind of research and teaching kind of across the medical school. And we've done various undergraduate and postgraduate medical education projects, and my background in psychology as well, and I did a PhD in medical education.
Oh, fantastic. So I just guess, and that really does set the scene quite nicely. As Millie said before, this really is on topic, especially for the current contemporary climate within healthcare within the UK, just looking at effective teamwork. So I guess my first question would be, and Millie, if I could get you to go first, is why teamwork is such a difficult concept to define, and indeed why did you undertake the study in the first place?
Yeah, so well, Paul might be able to add in as well for this, but yeah, basically it's as all our healthcare now is, all patient centered, and obviously working as teams is one of the key things. There's a lot of research looking into, what makes good interprofessional practice and how we do that, but obviously our the diverse workforce as well as diverse patient needs. So I think sometimes as it comes up in the study, we just sometimes don't do it very well. People, with work pressures and high workloads and things, it can just be difficult to actually work well as a team. And I think so we kind of expect our doctors and nurses and all professions to just kind of do it without really knowing how to do it often. So that was one of the main things that, kind of I thought was important. But Paul, you probably got more to add to that.
Yeah, so teamwork really is a social dynamic and a construct that's put together in kind of how people might interact with each other, kind of what the functions are and the various ways in which people work together. And healthcare by its very nature is a real mixture of many different professions working together, people in different roles, different levels, all kind of, coming together at various times in various different ways as well. So the funder for the study, the General Medical Council, were keen to look at kind of the ways in which doctors are working and interacting, not just locally within kind of their immediate teams, but also kind of across systems and across wider teams, and really just being alert of kind of how important teamwork is as a construct, to reaching kind of patient outcomes as well. And so a lot of work needed to understand the ways in which, people and individuals and teams can be more effective, so that we can enhance patient outcomes, really.
So, Paul, let's just look, and I'll get you to go first if that's okay. Just at the key findings and sort of headlines of the study. Could I get you to speak to some of the key enablers and indeed barriers to effective teamwork in healthcare settings that the finding that the study sort of uncovered, and then we'll go to Millie afterwards.
Yeah, so within our research, yeah, we looked at both the enablers and the barriers to try and unpick the various different elements kind of involved with how kind of teams work together. And so we tried to break it down into various different ways. So looking at kind of individuals, teams, and organizations as well. But we kind of put together some enablers of effective teamwork. So within this, particular highlights were things such as ensuring that the time and the structures are in place to allow the teams to meet regularly. So kind of the organizational functions, the proximity of teams being there, and both kind of how teams can be put together. Things such as the supportive culture, effective communication, making sure people understand each other, are kind of supportive of kind of the different challenges that go on. Leadership also being a key kind of enabler. So being, approachable, making sure that leaders are kind of clearly defining the roles of themselves and of others within the teams as well. And also kind of helping that respect kind of across the team members, making sure people feel valued within that team, and making sure people are kind of working together as well. And then also things such as the continuity and the experiences of people as well. So kind of, the more people are working together, building up those relationships over time as well, getting to know kind of how things are done, and also just experience over time. So again, people in roles for kind of longer amounts of time in the same settings, getting to know each other, kind of knowing how each other kind of people work in different situations and the way in which they might respond to certain triggers, so then they can work more effectively together as well. So we kind of looked at various kind of different elements of those across, like I say, the individual, the team, and the organization, and all kind of interlinked as well, kind of within some of those areas.
So, Millie, as Paul has just mentioned, it's multifactorial, but effective communication for teamwork is a fundamental aspect of that. And something you both illustrated actually is the UK healthcare climate now, and not even just the UK healthcare, just within Europe and North America and other healthcare ecosystems are really multicultural, actually. And a foundational part of that where cultures collide is this effective teamwork piece. Millie, could I get you to speak to how important communication is in for teamwork and some of the strategies highlighted by the study that can improve communication within healthcare teams?
Yeah, so obviously every single participant mentioned communication, I think, as we would have expected, because obviously, we're always trying to make, like I said earlier, it's all about kind of patient-centered care and things. So the way we communicate is just like key. But obviously an issue that comes up a lot is how people communicate with each other. So when people are speaking about effective communication, it's things like, just making good eye contact, being empathetic, which is key, just being kind, asking others, for advice and support when you need it, because that being open communication and actually speaking up is really important. And we found that to be when that communication isn't there, people won't speak up. So if they're unsure, especially with newer roles, that was an issue that we probably will touch on later. But yeah, just kind of listening to each other, making people feel part of the team, even like using names, because often with this hierarchy, which we'll mention later, just calling people by their name makes people feel valued as part of the team. So it's all about really building that relationship and just speaking out, and conflict resolution was another thing that came up. Obviously within that team, it's just like sharing that information and, just making people feel part of the team. And then that all, we found that, from the literature and what we're speaking about with participants, it just basically meant for better patient care and smoother handovers, which is obviously key. So I think some of the things that strategies are things like better induction, so making it clear what we expect good communication, because as we mentioned, international medical graduates, when they come over, sometimes that the way they work as a team in their country is completely different here. So having that induction that actually spells out what we mean by working as a team, what good communication is, making people's roles clearer and understanding that, and allowing clear lines of communication. And one of the key things really with all of this is having good leadership that will kind of be passionate about making that happen and making people aware about what communication is expected. So there's some of the, I don't know if Paul's got any more to add, but there's some of the things that we thought would help.
And yeah, Paul, to yourself.
Yeah, absolutely. I think the strategies really, again, are kind of mindful of that integration of kind of how people are working together. So just trying to think, from the outset, are people clear about, what the roles are? So through the induction and then through that kind of ongoing socialization in terms of into the workplace, being mindful of different kind of individual characteristics that might, be thinking about what could we help and how we can how people can better work together as well, within those, kind of fostering those relationships, because the nature of the workforce is very diverse. So just trying to make account for kind of individual differences within the communication strategies and with kind of events, the ways in which people might come together to kind of build those networks as well. Make sure you're not excluding people and kind of drawing people in through those as well. So it's just really being clear of those different approaches and trying to be, I guess, flexible in what's needed as well, for different situations, for different groups, because of I guess, again, the nature of the healthcare workforce and the systems in which people are working. Sometimes it can be a team for a short amount of time, or sometimes a team for a much longer time. So there's different ways in which you might need to tailor some of the strategies there to be more effective.
So Paul, to you first, and then to Millie, around just what aspects of effective leadership are highlighted within the study, and indeed, I guess what qualities are essential for leaders to enable positive team dynamics. And I'm just going to sort of posit something Millie just said there about effective listening and active listening, because that is such a fundamental key component of effective leadership, showing someone that they've been listened to and almost reiterating their message back to them to show you are listening to them. Could I get you to speak to some of the qualities of leadership that study highlights?
Yeah, so within the study, we found that people particularly liked when it's leaders that were approachable. So they were kind of there to support them with whatever needs that they might have. And that's like an instant way in which the team can then function, because if there isn't that approachability kind of at the outset, then it then makes it very difficult to kind of overcome if there's any kind of discrepancy, if there's any disagreements or challenges. So without that from the beginning, then it then becomes more of a challenge, and a knock-on effect of the team kind of function kind of going down from there. And the handovers, the communication, everything becomes more of a challenge. So often having that openness within the kind of the communication from the leadership, helping that within the team, and also being mindful that the leader isn't always the person, the most senior person. It can be just the leader within the regard of what's going on within the patient as well. So everyone feeling that they're valued and listened to, they're kind of taken seriously and kind of what's being needed, but also that leadership again is quite a flexible. It's not just one person, but it can be multiple people within that setting. And then also things such as ongoing monitoring feedback, so making sure that people are checking in and seeing if things are working or not, or kind of giving that open way of communication within feedback as well. So, if there are difficulties, that they're being kind of looked at and not just kind of time goes on. So trying to pick up things at the earlier points with more kind of informal resolutions as well. And Millie, did you want to add some of those?
Yeah, I think basically the key thing for this is that as we all want, everyone wants like a nice senior person to work under. And it's seen it many times, different trusts, different places you work. Sometimes you have like an amazing leader that just kind of gets it right and helps build that culture. So things that people talk about, being charismatic, being calm, being welcoming and compassionate. I think people underestimate the impact that actually has, and obviously it could be about the person. You can't expect everyone to be the same, but I think some people talking about the fact that you just have someone that's really good at the job, that can be really technically very good, but just not a very good leader and not very good at kind of building a nice team. And then you get people who are just not really interested in being part of the team or building that network. So I think people kind of commented how important that is to kind of also for the next generation of doctors coming up, because we know, like generational differences. Sometimes you get maybe a consultant that's kind of just very fixated on the job and that's it, doesn't really want to speak outside, and and then as we kind of go through the younger generations, it's important to kind of feed that through. So I think they were kind of saying that it's important as well for the next generation to learn what makes a good leader and the positive impact that will have on the team.
Absolutely. And I'm absolutely in agreement with you really around the presence of good non-technical skills as well as technical ones, because it is the soft skills which allows cohesive teamwork. Again, it's around sort of sharing mental models, sharing the acceptable baselines of what is expected, but also of feedback and communication, as to Paul's point around making sure that the feedback is both listened to and actioned, actually, so that people feel like there is an actionable sense of progression to whatever's fed back to make sure things are working better and that people are listened to within teams, and demonstrating that within ward rounds or indeed at start team meetings, just to make sure there is a sense of, I think, fundamentally agency for junior staff, that junior staff feel they have agency to speak up, agency to change systems, and I think that's a key driver. Millie, I'm going to get you to go first, and then I'm going to come to Paul, just to talk about some of the barriers, some of these profound barriers that are articulated within the study, and looking at hierarchies. Medicine has archetypally and historically had some pretty profound hierarchies of power and power imbalances and role hierarchies. Could you maybe speak to the impact these have on teamwork and what can be done to address these issues?
Yeah, so obviously, like I said, it's like a historic thing often. But firstly, like kind of the power imbalance and that as the first one was kind of noted more between, say, like the us and them mentality. So, like, say, between doctors and nurses. So I know it's not like that everywhere, but obviously there can be issues between, yeah, like that us and them. So just not gelling together and working as a team. So maybe just nurses often being a bit fearful of doctors, or doctors not making nurses feel like they can ask questions. So that's when that breakdown often happens, and inability to speak up, which is obviously one of the major issues in terms of patient care. So having that feel of the teamwork in that regard, that you can just anyone can speak up. So we kind of had examples in other studies as well as this one, where if you see something going wrong, people are scared to kind of speak up because they're a more junior, or so whether it's a junior doctor or a different profession, say a nurse watching something happen in surgery, and they don't dare speak up because of that hierarchy and that power imbalance that they're feeling. So that's a major one in terms of patient safety. Which I think hopefully is not as bad as it used to be, but obviously it's still happening because it came up in this study. And then the other one around the hierarchy is sometimes if there's that difference, it can often lead to kind of like a bullying culture, which is a big thing. It has been for a while within the NHS. Often, making feel intimidated, and again being unable to speak up. So, and that again leading to things like clinical errors and poor patient outcomes, poor handovers, because sometimes you just maybe fearful to kind of ask questions, so then you don't fully know what's going on. So there's some of the major ones that came out. And just, yeah, so often it's the different unfortunately there's different what's the word, like say for example within surgery, we know it could be often a different culture there. So like I said, it doesn't always go on, but obviously it needs addressing when it is taking place. Paul, I don't know if you've got anything else to add.
Yeah, so in terms of strategies and things, I mean, there's different gaps, I guess, between the different organizations. So sometimes, there can be policy differences in what approaches to take. So again, that can add to the mixture of different elements in terms of what people experience if they're moving across different organizations. Some things might be done one way, in one team in terms of that hierarchy, and then in another organization, another team, another setting, there's different policies and there's different approaches. So again, there's challenges there. So that the organizations themselves can maybe look across to see what's in place. How can they help to facilitate some of that breakdown as well? And things, across different healthcare professional groups, just trying to perhaps, have more shared understandings around kind of, the roles, responsibilities, what is the scope of practice, where are the boundaries? Again, there's a lot of variation across different hospitals, different organizations, primary care and secondary care, and kind of how different healthcare professionals function within those settings as well. So there's all those types of things that could be tied up to help with those understandings, and through that the communication can be enhanced, and people might be more understanding of kind of why certain things are done, or kind of how decisions are reached as well. So there's again facilitating those kind of clearer lines of communication and that ability to speak up. Hopefully that, if there was a kind of patient risk, that there still is that ability to kind of challenge, whether it's within professions as well. Sometimes it's different levels within a certain profession. So just trying to think, how can we help to facilitate some of those interactions as well across them? And there's things that just kind of remain because that's the way things are done, and trying to just challenge the kind of the ongoing approaches really, and not just having following the same process and procedures because that's way that it's always been, but just trying to think, what can we do differently, and how open are we to doing that as well. And as people change as well, kind of over time, different education, undergraduate and postgraduate, it can all help to enhance those kind of characteristics as well, kind of what's been done over time.
So something I've been getting really from you both, it is around, and it kind of leads me into this next question around how we can, and indeed how the study articulates healthcare organizations create a positive and supportive culture that promotes effective teamwork. And something you both said really is around this freedom to speak up. And there is within the NHS freedom to speak up champions and this kind of freedom to speak up schemes which are starting to proliferate across the NHS and indeed wider, which, like you say, gives avenues and doorways and opportunities for staff to really articulate if there is a deficit in patient care or indeed a culture of bullying or any kind of adverse practice really. So that really is one key aspect and making these avenues available to staff. Maybe Paul, if I could come to you first around anything else that the study articulates in regard to creating a positive and supportive culture.
Yeah, so within the study, we found when people were talking about a lot of their positive experiences, it was highlighting some of these factors really that really help to facilitate that. So things such as the stability of the organization and the structure. It's an area that's very challenging, particularly, for the funder, for the General Medical Council. They don't have as much control over, how the organizations function as such. And so the ways in which people are working is within a system. And even that system itself is not one static approach. It's something that changes again, with different policies and different ways in which the organizations are set up themselves. But we did see within teamwork that particularly when there was that stability kind of over the longer term, when people did know, kind of where their working situation, who their colleagues are on a regular basis, within the team, kind of how to go and get support and where to reach out to, and kind of how the whole kind of organization functions. Then with that structure, really, I think it helps to just enhance that effective communication within that. Other things such as the protocols, administration support being in place and helping different people as well to think about, what they can do and how they can kind of communicate to that regard. And just being aware of, again, healthcare practice changing, that it does need flexibility as well, with different kind of people involved. Like I said, the changing scopes of practice as well. So just being mindful of kind of how that might be brought into teams as well. And thinking about, within this team, certain professions work in this way, but within the other teams, it might be different. So again, trying to just get everybody onto the same page in that regard, and how they can kind of work more effectively together.
Millie, to yourself.
Oh yeah, I think that covered it really. It's a really hard culture has always been and always will be just a really hard thing to change. Like Paul said, it's how things are done around here. So I think obviously it's not down to one person. It's a team effort to change the culture and the way things are supported. So yeah, I think it's a larger organisational thing, isn't it, rather than individuals.
Well, Millie, as you just said there, and one of the problems and challenges, certainly within the ecosystem of junior doctors, is rotational aspect of junior doctors is the cadence is every 6 months or indeed sometimes less, but it's you're transiting in and out of all these different ecosystems of good and bad leadership, of good and bad teamwork. And maybe good to great sometimes. It's not necessarily always bad, but there is a lot of transition, and with that comes, as you just said there, the individual has to understand what is the cultural ethos in all these different subspecialties.
Yeah, I think like you said then, there's all these, so rather than just cultures, all these mini cultures. So every ward does things different. Every little tiny staff team does things differently. So I think for junior doctors, when they're rotating so often, they're always feeling like the new member of the team, basically. And I imagine by the time they're about to leave, they're only just getting to grips with how things are done and the culture that they're within in that kind of, whether it's the ward or like I say teams that they're in. So often, you know, it's difficult to build relationships and build that familiarity. So by the time they're leaving, they might have just made some nice relationships and then they're kind of gone again, and then it's back to the beginning. It got to like new people to work with. So they often commented on feeling quite isolated as a result of kind of moving around and that lack of continuity. So again, not feeling like maybe they can ask questions, because I mean it's quite comes out quite clear that kind of nurses and doctors, they need each other. So often doctors have said the best teams have been in are when just nurses know what they need, they get it done, and you kind of, obviously it takes time to build those things and kind of like the more informal connections with people. So nurses might just learn to understand what certain doctors need and vice versa. So I think teams, obviously it takes time to build, and so while they're in these like transitory and rotational roles, they're just never able to build that, unfortunately. But obviously it comes with the territory of being a foundation doctor. So even though, you know, there are the cons with it, obviously the other thing is they're getting all this experience, and it's probably making them quite flexible in terms of the way they work as well. So even though it can also build quite a lot of tension, it has got a lot of positives with it, really. So yeah.
Yeah, and Paul, to yourself.
Yeah, absolutely. I think it's quite well documented the challenges that people are facing in terms of these rotations moving around the country, you know, different settings, locations, different teams. As Millie talked about, you know, that lots of different factors there about not knowing, you know, other team members, and just feeling, you know, not part of that team necessarily, and that takes time. But the positives, I guess, you know, through that as well, that it is enhancing that flexibility that people do have in terms of fitting into teams quickly. And if they are having to work in acute situations, you know, where the team comes together, they've probably got those skills that they've been able to draw on through those rotational experiences as well within that. So, you know, with each of these, I guess, you know, there's strengths and weaknesses in terms of the approaches. But the, you know, the challenges there in terms of team makeup, again, it will kind of reinforce, you know, some of the more difficult situations. But then, like you said before, if you then move into a really great team as well, it can give you that experience. So you're no longer, you know, in a stressful or a bullying situation. You might be able to go into a different situation as well. So again, you know, there's lots of just ups and downs really, but it's something that's kind of a feature of the junior doctor, kind of the way in which the setting is set up. And it's something that, you know, the funders are kind of listening to the study as well to think about, you know, what can they do within this as well, and how could they approach things slightly differently, learning about the experiences here.
So as Millie said, it's a complex environment because junior doctors are really starting to get to understand and indeed build relationships, and then they're moved on. But there is another factor involved in this, and Millie, I'll get you to go first in this. Is really the relationship, and it has changed over the past few years with allied healthcare professionals, so such as physicians assistants or associates. And indeed, how that looks, because they've taken on a whole cadre of work to quite a senior level, an advanced level, which has almost shifted some of the workload away from doctors. And again, that's a relationship and indeed a baseline of understanding which junior doctors have got to become acclimatized to. Could you maybe speak to just indeed what the study shows in regard to integration of new roles, such as physicians associates and advanced clinical practitioners, and indeed how they've been integrated into existing teams?
Yes, I think the main thing is really that the lack of knowledge and understanding about what some of them are. So I don't know. That's obviously more of something really needs to be done about actually making people aware of what they're able to do and what they can't do. Things like that, which then causes tension and issues within a team. So, you know, asking someone to do something that they shouldn't is obviously not a good thing and not a good thing for, like I say, a junior doctor, because maybe they're not as understanding as what a more senior colleague could be. So the main thing really that came up was just a lack of understanding about roles and what people can and can't do, what they're expected to do, and just like, yeah, why they're there really. And you know, they shouldn't be say prescribing in certain roles. And then we had examples of where they've been asked to do that. So then again, this tension is just there. So I think that was one of the main issues really. And obviously, as Paul mentioned before, things that can be done with that are just like, inductions, making people clear what roles are, and just, I don't know, more information really, I think, around these roles, because obviously they're gonna, they've been here quite a while now, so you'd have hoped that maybe it was clearer, but I think there's still a bit of an issue with that kind of feeding down really, and information of their roles.
Yeah, and Paul, to yourself.
Yeah, so again, there's a lot of variation in kind of the roles, responsibilities, and the scope of practice within different settings within primary care and secondary care. So there's still differences in how some of these professionals might be then interacting with colleagues again across these different settings if they are doing different kind of work or different experiences within some of those. So again, there's just misalignment between kind of what they might have done in one place between another place, and differences between what they're expected to do themselves, and interactions there as well. So there's really, yeah, kind of, and it's not just physician associates, it's kind of in general within the healthcare system as well. There's over time there's emerging roles, different kind of variations in the grades and the levels, about kind of who's contributing to healthcare and the ways in which they're doing that. And again, the overarching theme, and just how effective that communication is, but also patient outcomes being core to anything that is done. So, just making sure that essentially that's the main priority, but the ways in which the team works together, it all needs to be working towards that. So it's not trying to kind of make differences between professions, but ultimately how can everyone work more effectively together, and how can the team function as best it can be. And there's still a lot of work that needs to be done there, again within the healthcare setting, within different regulators and different organizational bodies, to think about the best ways in which that integration can happen, to the most kind of effective way.
So one of the key aspects, and I suppose in a way, elephants in the room within the NHS, is just the overwhelming workload which is faced by all staff really, but certainly by junior doctors and indeed senior doctors. But could you maybe speak to, and Paul will go first with you yourself, what the study articulates in regard to high service demands and indeed workloads on teamwork, and how these pressures can be mitigated?
Yeah, so really it's very well known, the NHS is under enormous stresses and pressure in terms of the amount of work, the amount of patients, the volume, the different types of care that is needed, and delivering that in a way, within the workforce situation as well. So really to think about that context is key in terms of the shaping of this as well, because how can you have effective teamwork when people are under such pressures to deliver healthcare, and often by seeing teamwork as less of a factor, but it's also essential in many ways, because when you look at breakdowns around patient outcomes, often the key elements are around teamwork and communication. So it really is integral as well to that extent. So just trying to kind of bring it to the forefront in terms of people's mindset, and how we're thinking about this, within undergraduate and postgraduate education as well. So it's kind of a more of a routine feature, and not just seen as something afterwards. People might have the clinical expertise, but then they don't actually know how to work effectively together. So trying to bring that in. But we saw that in certain situations, again, kind of acute care was quite a good example, where different professions were kind of working effectively together and coming together at certain times, and really within those high pressure service demands environments, that those teams kind of functioned in certain ways, and they knew each other well. They kind of knew each other's triggers in response to stress, and kind of how to communicate as well. And again, a lot of the factors we mentioned previously, they were kind of aware of those within their kind of team, so that they could kind of get through that workload. And again, that those kind of lines of communication were much more open. So we had quite a few examples from participants, where they felt that although they they do have this enormous workload pressure and the stress, but they felt their team was a protective bubble in how they're able to kind of mediate that impact, and kind of they felt that they were in the best place in terms of being able to work with that. And again, it was one of those things where if you have that experience, it then makes you stronger, through that as well, and the team is stronger. They're able to respond to situations at different times, and kind of think about what can be done. So yeah, I mean, it is the elephant in the room, with all of this. I think, teamwork is impacted through the pressures, but there's still a lot that can be done, and learning about, again, the various elements we've discussed and how to bridge some of those gaps.
And Millie, to yourself.
Yeah, I think that's the interesting thing that you're saying, Paul, is that it's almost like having an amazing team and an effective teamwork helps to overcome some of the high service demands and the massive workload. And then obviously the other side is certain areas and cultures, the high service demand and workloads are then hindering the teamwork. So, I mean, if you're feeling burnt out and stressed, exhausted, undervalued, you don't want to go and then, on a social event with your team who probably maybe don't like half of them because of the way the team is and the friction. And so I think it's that thing, getting the balance. And obviously maybe we could use the kind of case studies from the acute care to help with that and show people that, this it'll work if you do these sort of things, and invest more resources and activities and kind of building them relationships. So I think people, like Paul said, it's just an add-on, maybe a tick box to have a little social event and things, but actually it's important to build them relationships. So it's making people aware that you need that time and the structure to actually build the relationship to then ensure more effective teamwork in the workplace. I think it's a bit undervalued, the importance of that, really. So maybe we can do something to kind of promote that a bit better.
So Millie, just looking at individual factors such as temperament, personality, and indeed communication styles, how do they influence teamwork dynamics from the study?
Yes, I think we touched on it a little bit about, especially, more senior colleagues. People were commenting on kind of their working style and just basically being an effective team worker and an individual that kind of displays certain characteristics. So, being friendly and approachable. We mentioned leadership before, just basically like a temperament that kind of matches the job role, but also is important for teamwork. So, for example, it's important to have a certain temperament if you're a surgeon. So, for senior surgeons, people comment on, have to remain calm in high pressure environments, or sometimes, for example, a psychiatrist, a senior psychiatrist, maybe takes more importance in caring for the team's mental health needs. So, it's kind of, I think, depending on what your role is, it needs to match. But along with that, influences communication. So like we spoke about before, eye contacts, open questions, reflecting. I think some people just naturally do that better. You get people that kind of just take it more as a serious thing compared to others who kind of just get on with the job and kind of, this is what it is. This is it's about the patient. This is healthcare, and we just kind of get on. So I think the individual factors and whether they're a good leader and things like that, it is really important, and it will influence and trickle down to the rest of the team, really.
And Paul, to yourself.
Yeah, so I think I guess there's certain professions, certain areas where certain approaches might be more effective, more commonplace as well within that. So it's not necessarily that it's kind of a one size fits all, but kind of the way in which people work together, some of the barriers to breaking down the communication and just, I think the education systems in particular could help with this to more regard in terms of the standards of kind of what's required of people in how they work in teams, because it's something that kind of features in kind of more towards the later stages within education and training. But it's something that we could look at, to try to embed it kind of earlier within the kind of the educational systems as well, just to help, like those ways in which people are working together, and their kind of understanding of each other as well.
So just looking at how, indeed, we have spoken about international medical graduates and indeed different cultural ways of approaching teamwork. And could you maybe speak to how this study recommends how medical graduates from different cultures integrate within healthcare teams in the UK, and indeed how these differences can be addressed?
Yes, I think the main thing really is, like you said, it's the cultural norms really. So we know kind of international medical graduates, massive percentage of our workforce, in all, not just doctors, obviously in all professions, but it's mainly, no one ever questions it's not the medical, like all the technical skills. It's more just how they do things sometimes. So in terms of maybe like one of the things that I can think of is relationships between nurse and doctors. So in some cultures, for example, the doctor kind of just no please or thank yous. It just tells the nurse what to do and that's it. And I've kind of in some of previous work that I've done, the nurse kind of complains that the doctor's really rude, when actually they're not. It's how they do things. And then until the doctor's told, they didn't know it's that thing. They didn't know they're doing it wrong or different until they're told. So a bit more of that induction really, and the support interventions is definitely needed. Because I kind of think sometimes we expect them just to get on with things and just like learn how we do things, but obviously it can make it really difficult. And in terms of teamwork, fitting in, because they might sometimes feel a bit of an outsider because they don't know how our teams work and things. And obviously teamwork in general is sometimes just less of a thing in other countries. So that hierarchy can still be there in certain countries. So kind of do as the doctor says, and then that's it. Don't question. So yeah, better inductions and more support, and just educating on how we deliver healthcare in terms of sometimes the patient centeredness and just the team around that, what's expected.
Yeah, so the healthcare system is hugely reliant on international colleagues, in various professions, working across the country and across the UK. So it's something that is really essential and something that's we did find that there were some barriers there in terms of inclusion, diversity, and kind of how that was embedded within the teams as well. So it's something that there is kind of work to be done there, and like we discussed previously around inductions, ways to do that, thinking about some of the challenges and how to support people, but also kind of doing that over time as well, so that they do have kind of check-ins with colleagues, with peers, kind of across the region, perhaps, or different ways that we can help to support people. But there's still things that we can help to bring in. That there are kind of various inductions, but there's still kind of some gaps in terms of the information, and even then, policy changes again across different organizations. So somebody might work and that might be the way that something is done in that situation, but then they move, or they might pick up like a shift or something in somewhere else, and again there's a different change, and so yeah, so again there's some of the barriers there that they have to overcome in terms of fitting into that new kind of workplace setting.
So, Paul, could you speak to some of the limiting steps of the study?
Yeah, so for the study, we were looking at teamwork as a concept and kind of trying to draw those links between where people saw effective teamwork and the outcomes. But there were challenges in terms of actually directly linking certain outcomes to kind of the situations as well. So in some situations, it might be using such things such as turnover, time off sick, and well-being measures, that give indications into how the teams function as well, and trying to think about, again, those barriers enablers that link through to those areas. So with more time, a broader study could perhaps go into more detail to unpick some of those kind of links and relationships and within those characteristics. Within the study itself, we did have quite a large qualitative sample in terms of the numbers involved within the interviews, and we looked at a lot of different experiences of different professions across the groups. But again, with a kind of a wider study, we might be able to go into more detail into specific groups, and kind of the experiences, within certain situations as well. We did kind of go into depth in terms of the experiences that people had, and trying to look at some of their kind of, again, those good and bad experiences of teamwork, and trying to unpick the elements of that. So whether we'd get more information is not quite clear in terms of whether it would actually help, but just in terms of perhaps the reach of the sample itself as well.
And relate to yourself.
Yeah, I think that covers it really. I think it's just there's a lot of groups and other types of professionals that could have maybe been included, but obviously it was a very large sample, so it's kind of robust, but yeah, I can always do a bit more.
Yeah, indeed. So just as we finish off, could I get you both to speak to some take-home points really regarding meta themes and indeed that emerge from the study and indeed what we can learn from them? Millie, if I could just get you to go first.
Yes, I think the main thing is really just the importance of teamwork, and we've highlighted, when teams work well together, kind of things like the supportive and positive culture, the communication leaders, just effective handovers and better care will be an output from it. So just kind of sharing that importance really of what teamwork can do, and showing that continuity and familiarity, and just the overall experience of our teams. We want people to be happy and working. So something that could be done to ensure patient outcomes are improved, but also just that teams are happier. And obviously just being aware of the roles that we talked about, such as foundation doctors, them kind of rotational transient roles, the impact that could have and what we could do. Obviously, not a lot can be done in terms of not asking them to change the structure of how they rotate, but just being aware that that's there and how we could support them better. And then the other big area is kind of that mutual respect and support for kind of newer roles, for newer colleagues, people that aren't originally born here in this country but come from overseas, that we really value and we need them. So just ensuring that we make everybody feel part of the team really, and how we can do that, and the negative impact that could have if we don't really.
And finally, Paul, to yourself.
Yeah, so teamwork is integral to kind of effective healthcare workforce and enhancing patient outcomes. So really this study, through this realist evaluation, it kind of gives us a lot of detail about the ways in which teams can work together, looking at both the barriers and the enablers in terms of what people can do. So not just organizations, but also individuals, what people can do, what teams can do, and various bodies that are involved in terms of regulation and healthcare organizations as well, thinking about some of the factors that they can look at within teams. So the study goes into a lot of depth and detail across those different areas, and trying to unpick all of that integration of those different factors, and hopefully kind of guides people a little bit in terms of what they might be able to do at a local level, how they might be able to change things, and think about specifically what are some of the factors that we could look at in order to kind of help more effective communication within the team.
Listen, that's fantastic. And just really appreciate both of your input really in this last hour, because it is a fantastic study. It really does look at some of the meta and sub themes to effective teamwork. I think what we'll do in the show notes, we'll put the links to the study so that people can go away and read this study and really unpick some of the fundamental key aspects of the study. But it just leaves me to say thank you for the last hour, both Millie and Paul. It's been fantastic just to engage with you both.
Thank you. Thank you for having us.
Thank you very much.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.